Okay, good afternoon, everyone. Welcome to King's College London. My name is Richard Seah. I'm the Director of Aging Research at King's. Welcome to the audience who are here in person and also those who are joining us online, wherever you may be in the world. Welcome to this Aging Research at King's National Innovation Centre for Aging and also Collider Health Longevity Week event. I think I've covered everything there, haven't I?
Absolutely.
So it's my pleasure to see new faces and also old friends with us this afternoon. I'm going to hand over to Tina, who's going to manage and moderate the discussion. Please feel free to ask questions throughout. And those of you who are online, I think there will be a facility by which you can add questions to the chat. And we'll try and address those throughout the afternoon as well. Unfortunately, I think we're going to get a few pings because this is using Teams, and if people ping me, you will find that a little bit annoying, hopefully not too much. Great, so with that, thank you again, Tina. Lynn, of course, representing Nikkei, and the panelists for joining us this afternoon. So I'll hand over to you now. I'll manage the slides.
Thank you so much, Richard. And thank you so much for all of you who've come in person, because I know these days coming in person to any event is quite a commitment. But really pleased to see this is an event that's part of the Longevity Week this week in London. And there are many weeks around the world on longevity. It's a very, very hot topic. And we are looking at it from the point of view of how we can harness all the science and technology that we are finding really sort of exploding all around us, how that can find its way into the mainstream agenda and debate around prevention. So it's good timing to be holding this debate. We've had a recent budget announcement from the UK government on where they're going to be putting their investment and focus of activity in the years ahead, linking their health mission with the economic growth mission. So we're here to really explore all the themes and ideas really to make this a reality. So we had a huge interest in the event. We had over 250 people register, so that's great, and great that you've come here. So just a few words. We have Charlotte Bright, who was unfortunately unable to come in person because she was called out to a number 10 meeting that conflicted. But we have a video where essentially we've interviewed her on some of the key questions that will essentially seed the debate and the discussion that we'll have with our panelists. We have great panels. I will let them introduce themselves rather than myself, because they will do a much better job. But they will each, from their perspective, explain where they see the debate going in terms of prevention, how we can harness innovation and technology to that end as well around the health-linked economic growth missions. And really, we're going to explore how public sector, private sector, third sector, and the general public can really work together really to tackle what effectively is, well, it is a health emergency. And we're seeing that in most of the westernized world. I was in New York recently, in the US, actually in LA also recently. And, you know, the issues are a little bit different, but some of them are very, very similar. I know I see Linda in the audience. We talked a lot about how the social, for example, at an event in New York, how the social determinants of health are really dragging down the economy. We're seeing that in the UK. So these are really, really big burning issues. We have declining life expectancy in the westernized world. We have a growing health inequality gap. So these are really, really big issues that have really needed urgent attention, and ever more so now. And we really hope that the timing is right now for the new government to get this right. So these are all the sort of themes that we're going to be exploring. I wear a few hats, as some of you know. I get involved in a number of different sort of what I call mission ventures, some through Collider Health. I also run Business for Health, some of you will know. In fact, we're actually working quite closely with Charlotte Bright, who you'll listen to in a moment, on the metrics around how do we actually evaluate and measure the health and economic growth missions, working with the Office for National Statistics. So it's a key strategic piece of work that Business for Health is very, very involved with, and Pamela may touch upon that. And of course, the quantum healthy longevity, which you might have seen a couple of years ago when we launched that mission, that is still very much alive and well, because the lingo of the exposome is really starting to electrify and ignite attention in the scientific community, because we know that health, we are deeply, in fact, impacted by our wider environment and the social determinants of health. And it's that the science and technology is really coming out loud and clear that we cannot ignore that. To our peril, we ignore that. So this is very much some of the themes that will come through in the discussion today. So the Human Exposome Project was pitched a couple of weeks ago at X Prize, which, as you know, is running a health span X Prize. And it really ignited a lot of attention on how we must look at the wider factors that are affecting human health, and the westernized world needs to sort of sit up and listen to that. So that's so 2 years on, we're still very much sort of focused on that mission, and we've got people here who are very involved in that mission as well. So I will start off the discussion, and I will then hand over to our panelists after we hear Charlotte Bright say a few words and was grilled on a few key questions. So, Richard. And she is the Deputy Director for the Health Mission at the Department of Health, working very, very closely with Wes Streeting and his team. No. So thank you so much, Charlotte, for helping set the scene for the session we're about to run on driving the prevention society and economy. Just for those who don't know you, Charlotte Bright, Deputy Director of the Health Mission at the Department of Health and Social Care, who's obviously been very involved in discussions underway on health with the current government. So just a few questions that we wanted to ask you to set the scene, and really grateful that you're here. So welcome, Charlotte. Thank you.
Thanks very much, Tina. And I'm really sorry I can't be with you today, but this sounds like a great event and I hope it goes really well. And these few remarks that I make now will be helpful, as you say, in setting the scene for the conversation you're going to have.
Thanks so much, Charlotte. So we'll kick off with some questions. So we've got about four or five questions in total. So really our first question is, where is the government regarding the plan for the health mission?
Great, thanks, Tina. So yeah, it's really exciting times in terms of setting out the health mission. I'm sure everyone's aware that the health mission is one of 5 government missions. So there is also growth, opportunity, safer streets, and clean energy. And these missions really are setting the tone for the priorities of this government in terms of setting a really strong forward-looking agenda for this Parliament and beyond. In terms of the health mission, what the government's really trying to achieve on the health mission is how we can build a health and care system that is fit for the future. But really the focus we're taking is on how we can shorten the amount of time people spend in ill health. And partly this is driven by some of the kind of quite shocking statistics that you'll see if you look at healthy life expectancy across the country. So someone in the most deprived area of the UK can expect to live about a third of their life in ill health, and falling into ill health well below state retirement age, so into their 50s. If you compare that to somebody in kind of the wealthiest parts of the country, that's probably likely to be about a fifth of the amount of time they'll spend in ill health. So some quite stark differences in terms of kind of what people's healthy life expectancy is across the country. And so that's really the driving force behind what we're trying to do on the mission, because we think that by tackling that, not only do you provide services that are more responsive, but also you're helping support economic growth across the country by supporting people to remain in work, and you're addressing health inequalities, and you're supporting a more sustainable health and care system for the future. So that's kind of our guiding star, if you'd like. And then underneath that, there are 3 major pillars. So the first is a health and care system that is there when you need it. So that's largely looking at things like the constitutional standards for the NHS. So how are we doing in terms of the waiting lists, A&E performance, these core things that of course are really important for people who when they need health and care services. The second pillar that we're looking at is, in effect, how we can reduce premature mortality. So tackle the number of people who are dying from, I think the terminology we use is Britain's biggest killers, but largely that's cancer, cardiovascular disease, stroke, and suicide. And those are the kind of the conditions that really are sort of people are dying from in their 70s and earlier. And what can we do to sort of, in that sort of secondary prevention space, what can we do to support people to catch those conditions early and to provide appropriate treatment? And then the final pillar, which I think we'll talk a lot about today, is around fairer Britain and supporting people to live well for longer. And that's largely the sort of primary prevention area and how we can tackle those big social, commercial and sort of behavioural drivers of risk factors that drive ill health, the major risk factors. So those are kind of the three pillars. And then a lot of the work we've been focusing on is then how do we achieve this? What are the reform shifts? So the first, there's three of those as well, all the threes. So the first is hospital to home. So how can we support more care in the community? Treatment to prevention, that left shift to preventative care. And the final one is analog to digital, and thinking about how we can change also the workforce models to be more responsive and thinking about new technologies that are going to be on the horizon. And I'm sure everybody will have seen that we've launched a 10-year plan. And that is our kind of main vehicle for taking forward those three shifts. A major public kind of consultation, I think the biggest the NHS has ever seen. And so lots of opportunities for people to sort of feed in their views on the kind of the new NHS Change website and beyond that. And so it's a really exciting time for us sort of seeing, using that 10-year plan and that sort of public consultation to see how we can think about redesigning and reforming the health and care services.
Fantastic. Thank you so much, Charlotte. And I guess the next question really is sort of, because there's been a lot of talk about sort of linking health with economic growth. So I guess the next question really is, how does the health mission connect to the economic growth mission and other government missions?
Great, thanks, Tina. So absolutely, in the Secretary of State, I'm sure people will have heard him talk about this at length. We do really see that the health mission is making a huge contribution to the growth mission. I've touched on kind of economic inactivity, but I think there's like 2.8 million people now who are out of work due to health conditions, and overall that's kind of a loss of output for the UK economy of about £150 billion, 7% of GDP. So actually, if we can start to tackle some of that and help people remain in work for longer, it will make a huge contribution. Going beyond economic inactivity, there are a couple of other areas that I would highlight. The first is around the role of the life sciences sector itself, massive kind of sector for the economy, and is kind of a key part of this, of the government's industrial strategy approach. And then secondly, and I think a really interesting one, is around the role that the health and care system plays as anchor institutions in local places, and also as really large employers across the country. So what role can we play in terms of the way that we support skills in a local place, procurement, etc., and really think a bit smarter about the contribution that we're making. So growth is obviously a key link. But there are, as you say, links to the other missions. So absolutely an opportunity. How can we support children to be healthier, both in terms of those very early years, but also then in school and in terms of developing their skills. So absolutely lots of work going on with the Department for Education. Similarly with the Home Office on the Safer Streets mission. We have a keen interest in terms of mental health support and how people can access mental health services, violence against women and girls, and drug and substance abuse are key areas where there are kind of the Venn diagrams overlap between the health and the Safer Streets mission. And then on clean growth, clean air, obviously one of the major social determinants of health. So a big interest for the department in terms of how we can support clean air, but equally, going back to that point around the NHS being, having large physical infrastructure, actually what can we be doing in terms of decarbonising the NHS estate across the country and making better use of that? And I should say that beyond the missions, there's lots of work that goes on with all the other departments as well. So on housing, on the DFT in terms of thinking about transport. So although the missions are the focus, I think the missions also give us this opportunity to think more broadly about how do we work smarter across government.
Absolutely. Thank us. Some real food for thought, some of which you may have heard already, some of which you may not have. But effectively, we're going to pick up on the opportunities, but also the challenges. It all sounds great, but will it happen? I think is how can we make it all happen is the focus. So I'm going to turn to Cynthia Bullock first. Many of you will know her as, the former Deputy Director of the Healthy Aging Challenge, but now Healthy Lives, right? And you're going to talk about lessons learned, creative partnerships. And I think we've got a microphone here.
Am I sitting here or?
No, you're going to stay there, yeah.
Sorry, do forgive me, the light of the camera is right in our eye, so if I'm squinting, it isn't because, well, anyway. So as Tina has mentioned, my name is Cynthia Bullock and I work at Innovate UK. So just to say a little bit about who Innovate UK are, hopefully most people in the room know, but just in case. So Innovate UK is UK's innovation agency, as the name suggests, and we focus on business-led innovation. We support with grant funding, but we also have a number of different products that we use in order to support businesses to innovate and essentially produce the products and services that we all need. But we also think of a variety of ways that we can support them, recognizing that grant funding alone isn't enough. So we often put in what we call innovation support programs, working with partners to ensure that they really understand the market, they understand that customer proposition, and are able to target their products and services accordingly. So I'll start with saying, obviously, like everyone does, thank you very much for inviting me to talk to this audience. Very thrilled. I like to start with just kind of recognizing what we see, hopefully others do also, as the three mega trends, we call them, that is driving some of the change that we recognize in the prevention space. It's climate change, and this will come as a shock to anyone. The fourth, we think there's a fourth industrial revolution coming through, and the aging society, the aging population. We recognize that these are all complex and interconnected drivers of change. And I would argue they are driving also the case for the investment in prevention. The last 5 or 6 years, our team has been working to deliver the government's £98 million investment in the Healthy Aging Challenge. This was a programme that was seeking to support businesses to develop and produce, identify and develop products and services that will enable us to age well. And for us, that meant helping us to remain active, independent, socially connected, and productive. We think delivering that programme revived somewhat the case and the question of how government should plan for long-term investments. We also recognise that there's an undeniable tension between acting in the long term and working within electoral cycles. We think there's also clearly a competition for resources, which emphasises the need to build cross-party, cross-sector consensus in these situations, something that Charlotte also mentioned. Our experience of the Healthy Aging Challenge highlighted 3 factors. We think these factors really helped drive home the impact we've been able to achieve and are achieving within the investments that we made. The first, we believe, is having somewhat of a North Star. I think Charlotte called it guiding star, but similar idea. The mission, that was the sort of foundation of everything that we funded, was around to improve healthy life expectancy by 5 years. I think the number was, the duration was by 2035. We think this really helped focus minds. It focused our investments, focused our conversations, it focused our interactions. The second was about introducing a level of granularity. So we worked with partners, the Centre for Aging Better, a think tank in this area, to really understand what we thought were the 7 key areas that innovation could help drive our ability to age well. They were broad enough to spark interest in multiple sectors and generated a community of innovators and researchers that addressed everything from financial well-being, mental health, physical health, but also housing and vibrant communities, again, something that Charlotte mentioned, as well as dealing with loneliness and social connections. The third area and factor we think really helped was the idea that we wanted to approach our investment with a level of flexibility. So we wanted to be able to respond to the market. We wanted to test that things were working and learn from that experience. I'll finish with this comment. We need to maintain the idea that the aging population is good news. It is a good thing that we are all living longer. Recognizing all the complexities and the issues around inequalities, the fact that I've just learned recently that the global average age of life expectancy is 70 years is a great thing. Now we know that there's more to do, but ultimately this is an opportunity. We need to also acknowledge in our experience that business is poised to respond to these changes and the market demand that we see within the system. But I think what is missing is the incentivizing of those ecosystems to enable those partners to be able to respond appropriately. And if we can do that through either the missions or other areas of investment working in partnership, then we will go a long way in addressing the inequalities and such that everyone benefits. Thank you.
Thanks so much, Cynthia. I think some very interesting themes already, the short-term versus long-term, and I think the incentives, critical issues that perhaps will come through in the discussion. Do remember to think of questions that you'd like to ask us. There will be time at the end, and also we'll keep an eye on questions in the online audience as well. So over to Pamela Gallatley, who I've worked with for quite some time now.
Yes.
In the context of Business for Health, and I think even the early days of the All-Party Parliamentary Group for Longevity.
It was.
So, yes, so we've had the budget announcement. What is your view, in talking a lot from the employer's perspective, but businesses in general as well, in terms of driving the prevention agenda, particularly in the light of the budget announcement? Where some of your thoughts, and I know you've got some slides, which we'll put on to.
Yeah, I'll answer the question first while Richard is loading the slides. I think a lot of employers are very, very, very keen to push that prevention agenda. They understand it, they get it. We've just done a piece of research, not across about 500 employers, whereby we actually looked at what the employers were offering versus what the employees were recognising is actually helping. Interestingly, 87% of the people that we interviewed from an individual point of view said they felt they should be responsible for their own health, but only 31% actually said that they were participating in the benefits the employer provided. So there's obviously a mismatch there. And I think part of the problem is down to sort of data. And I think if we can, Richard, just go on to the next slide, and I'll run you through some of the things that are actually impacting on corporate, if that's okay with you sort of, Tina.
Yeah.
So, I mean, what the big drivers for actually sort of corporates is increases in sickness absence again. We've seen the ONS data for years and other reports, the Work Foundation actually talking, you know, it gone down to 4.4 days, then it's 5.8 days, and it goes up to 7.8 days. In reality, and particularly in large organisations, it's significantly higher than that. We talk to organisations with 14 days per employee per year. We see them at 19, we see them at 20. And then I think in the latest research that sort of Vitality were doing, they were talking about 50 days lost per employee per year if you take into account presenteeism. Now, employers haven't got, a lot of them don't even record sickness absence very well. But what is really interesting, and bearing in mind I can't see the slides, by the way, but what is really interesting is that what we actually see is if you actively manage sickness absence, so you put triggers in place as to when you intervene, it makes a difference. I mean, if we're actually day one of absence for mental health, for example, we see 99% of people are actually being administered, they're being helped, they're being supported. With musculoskeletal, it tends to be fewer people. But when we look at short-term absence like colds and flu, digestive problems, things like that, a lot of people, even if you put a 90-day trigger, are actually going under the radar, something like, I say 87%. Going under the radar, and if you bring it down to 45 days, it's like 66%. And that is your biggest reason for absence, is your short-term sickness absences. And what we also monitor is people going off for repeat users. So that is a sort of major problem. Interestingly as well, when we look at the sickness absence, an awful lot of people suffer from what we call yellow flags. So psychological attitudes, beliefs and fears towards their health, or it could be towards work. But towards work is a lot lower, it's somewhere in the region of 27%. So interestingly, a lot of people have perceptions that, if I've got low back pain, if I move, it's going to cause me harm. I'm very, very ill, it's going to cause me problems. So yellow flags are clinical yellow flags. They've been around for a long time, but interestingly, a lot of clinicians don't assess the psychosocial factors of ill health. And if we move on to the next slide, please, Richard. One of the things I did, just a bit of snapshot for the data, is actually look at, in sickness absence, what are we identifying when people are ill? What are we identifying as underlying causes and contributory risk factors? And as you can see, inactivity is huge. It's the number one reason for that we actually identify as an underlying cause. But then so is obesity. And if you look at those levels of obesity, both for musculoskeletal disorders and mental health problems, what we actually see is with a lot of clinicians, when people are assessed for these conditions, we're not assessing these and therefore we're not treating them. So if you've got somebody with knee problems and they're 3 stone, 4 stone overweight, and you're giving them physiotherapy, or worse, you're actually giving them a knee replacement, and you do not address those issues, they're either going to get a failed knee replacement or they're going to keep having problems, and we're not going to address the issues. So combination of this inactivity and weight are important in MSDs, but they're equally important in mental health. And what you'll also see on this slide is that you'll actually look at things like sleep. You can understand why sleep is a problem when people have got anxiety and depression, but look at it with sort of musculoskeletal disorders, but then look at alcohol consumption and look at smoking. And if I turn now, Richard, to just taking a snapshot from private healthcare. So these are the people where employers are actually funding for private healthcare treatment for their employees. You can actually see the data slightly different. Inactivity isn't as bad. Obesity is not quite as bad. So what's actually happening in this population is we are catching people early. And when we catch people earlier, we can help them and take them on that journey. But what we're doing with both sickness absence and with private healthcare and also with EAPs, we actually find that people are more open to actually starting to look after their health when something's happened, as opposed to the people when we're trying to just pure wellbeing programs where it's actively engaging, so it's never going to happen to me type scenario. So it's really sort of quite fascinating. And if we just go on to the last slide, which is actually looking, so what are employers actually looking for? And what are the problems that what do they actually need? Well, the national insurance contribution increase isn't going to help that investment. So we were, with what we've been doing for Business for Health, we've been really doing well in getting people very engaged in actually investing in whole of workforce solutions. So instead of just senior management solutions for private healthcare, they've been really interested in doing more. We're concerned now that that's going to dry up. And of course, the big issues that employers face, the 2 main reasons for sickness absence is musculoskeletal and mental health. So if the NHS are struggling, and those are the 2 big ones that they're struggling to actually deliver on time, then employers realise that they need to do something about it. But I think that NI increasing contributions is a problem. But what we're also seeing is absolutely exponential increases in the cost of private healthcare. Because what we're actually seeing is a lot of overtreatment. We see people who are actually going for unnecessary surgery, unnecessary diagnostics, unnecessary treatment, because once they've been told by a doctor that's what you need, that's what they will do. Whereas probably 85% of the population that we see, both in musculoskeletal, mental health, digestive, can actually help and get guided self-help. So this comes into that whole preventative piece. If we can help people and educate people to understand what they can do to help themselves, it would not only save the corporates a huge amount of money, but it will save the NHS and the government a substantial amount. And I think what else can we do? Well, I was talking earlier, legislation hasn't helped. Health and safety legislation, those of you that are familiar with it, really has driven safety risks down, but there hasn't been much focus on health. And a lot of safety professionals, health and safety professionals don't understand health. So they're saying, oh, it should be HR. But HR are not good at actually identifying risks and managing risk. We were chatting earlier that in health and safety legislation, there is a requirement to identify your occupational hazards and who can be harmed and how. But employers are not doing that. So I think we need to start looking at legislation, the Equality Act, health and safety legislation, and potentially other legislation. And how can we spin that to actually be more positive on the health side? And I think we'll then get more compliance with employers, but also employees, because they have a duty of care to themselves. And last but not least, we had the consultation paper on taxation, and we haven't heard anything back. And we have seen employees not want to have healthcare benefits if they're going to get a benefit in kind.
So this is all the box of levers, and it's the incentive structures and the carrots and the sticks that we have to look at, and which is a core part of our work with health.
I totally agree with Cynthia on that sort of like, the long term versus the short term, because a lot of employers see short term because it's here and now and then for them.
So I think so Pamela and I, we love data, and we know, and that's one of the reasons why the ONS are very keen on working with us. It's about really getting the data, which is available, but they're not it's tricky to get at the moment through the private sector. But there is a lot of data out there that can really be useful to analyze really what's going on in terms of the drivers of presenteeism, absenteeism, productivity. So that's a core piece of work, and I think just sharing data, between public and private sector is another massive thing.
And organisations, there's consortiums of organisations getting together, but also there's a lot of organisations don't know what they don't know, and therefore they're not collecting really, even sickness absence data. There's a lot of information which is missing. So I think there's a lot of data out there, but I think once we start getting that data, there's a lot of flaws in that data that we could actually say there's other reasons for that. But we have to start somewhere.
So moving on from data, so we're interested in data, we're interested in science and technology, we're interested in really, well, you're going to tell us all the work that you're doing, but it's this sharp end of the next generation products and services that will help us keep healthy and well, which is a huge opportunity. So tell us more.
This is a very complex and wide topic. I'm not sure I'm quite going to cover that. I'll give.
Do you want to use your slides, by the way?
No, I'll do this.
We'll just hold that
thought and just listening here. So I'm David Gunn. Nice to meet everyone today. I work for Unilever, and I'll give a little bit of perspective of Unilever. But I worked for many years in Unilever R&D and worked with a lot of research projects joint with universities, particularly in the field of ageing. For being Unilever being a cosmetics company, a slightly different view than say pharmaceutical. The interesting thing about Unilever is it sells many products across a wide range of areas, from foods, home care, through to the personal care and the beauty space. So it has an interaction every day. And when I hear about prevention and moving that prevention, I know within the company, if you try and sell products which have a very long benefit, in the sense of, if you take my lovely product and in 10 years, you will look 3 or 4 years younger than you would have done, people kind of say, okay. But then if I give you the product and it looks good, it smells good, it makes your skin feel good, sales go up. So the short-term benefit, the product has to be good. People have to get, and it comes to that idea of the incentive. talking about risk of disease and you know, in 20, 30 years, some people are engaged in that, particularly people who know they're at higher risk or have it in the family, but generally most people won't. They won't necessarily engage with that. And thinking about the quote about the wristband, like I've got Fitbits or whatever they are, the issue with a lot of those is that the people who engage in them and monitor themselves and so on are the people who are interested in their health and keeping active. It's the quite sizable percent of the population who don't engage with that, and how do you change that? And that's where I think the sort of the learnings a little bit on the skincare is you've got to kind of think about what is the I would say the culture a little bit. What are the multiple drivers that mean that person isn't engaging in healthy living? And then how can you provide them a short-term incentive alongside what most people already know, right? We mostly know keeping fit, eating lots of fruit and veg, staying away from the red meat and so on is a benefit. But that ability to engage people and get the behavior change is a really difficult area. And I've been involved in aging research for as long as being in Unilever, 24 years. And it's kind of, I hear the same thing. So it'd just be nice, I think, a little bit if we could have more research of actually going out into communities and trying different things and seeing what engages people, what helps. But I think it's not easy because it's more about culture. It's not one or two things. It's about changing the way that person, but their network of influencers, whether it's family, it's people in the same street or whatever, that they engage with, and more people talking about that and how you change that. I'm not 100% sure, but there are definitely ways you can go about it and give it a go and see what works best. So that's just a perspective I hope to help.
Well, what's interesting about what you just said, I mean, there's a lot of talk about anchor institutions in place, and of course the role of businesses and employers in place, and local employers, local businesses having a much more active role in being in the communities where they are, you know, on the high street, and the, you know, what's going on community health level. And I know, I mean, one of the things that the budget has announced is, you know, more money for local services, more money for place-based, and of course in our discussions with, you know, the team involved in the health mission, etc., in this current government, they're really interested in understanding how they can really tackle sort of community health, and looking at user journeys also in the whole kind of way that they're progressed through, you know, if they're out of work and what support they get. So there's a whole real big focus on all that. So, you know, communities are where it's at. And of course, it's a good segue to move on to Lynn, because behavior change and culture, I mean, these are massively important and are very much part of the work that I know Lynn has been doing, and I've been involved with as well. So over to you, Lynn.
Hi, thank you. I was lovely to hear from the other panellists. So my name's Lynn Corner. I'm the Deputy Director of the UK National Innovation Centre for Ageing, and also the Director of Voice, which is probably the world's largest citizen network, consumer network, interested in how do consumers access all of this information on healthy longevity. We are established by UK government originally to help the business of longevity, to basically have businesses, whether large multinationals through to startups, really realise this opportunity around healthy longevity, because people need the products and services, just as you're saying, David, in their homes, in their lives. And so from the very start, we had a focus on prevention, and we're delighted to see the UK government now adopt kind of real formal strategies on that. With Tina, we've been working to look at the business model for prevention, because simply wasn't there. There was plenty of incentives, as Tina said, for other areas, but this business model for prevention just seemed very elusive. And from the start as well, we've had a strategy on ageing intelligence, and that's because in our scientific communities, in our businesses, in our projects, we just have so much knowledge, astonishing scientific breakthroughs, you know, the work of Linda and others in terms of looking at kind of the roadmaps for longevity. We have enormous amounts of meaningful data data on pretty well every aspect, on health, on our cities, on our environments, on our kind of, predictors of poor health, on inequalities. But we have got to bring that together, stop it working in separate silos, and really understand how we can action all of that amazing science. Otherwise, it's siloed, it remains in ivory towers, and it's not accelerating healthier, happier, longer lives. And so with our partners, we've been working across the UK, but also internationally, to try and understand how we can make that happen. No one organisation can do this alone. This very much is about collaboration. We've got Joachim here from Germany and other places, Linda from the States, really about saying how do we actually leverage all of that amazing science and really bring together, as well as David so well said, citizens, communities, because so much of the nudging of healthy behaviours has to start in understanding the circumstances of people in our communities, in our poorest communities as well, not just the healthy getting healthier effectively. So we brought that together. We've been working with Jim and others on something called the City of Longevity. And I'll just talk a little bit about that now. I know we're short for time, but the City of Longevity is really about talking with local government, talking about communities, places, talking with people, with ordinary people, about healthy longevity, and actually making a very actionable open source way to bring forward all of this knowledge. And say if you were sitting in a local government, you might have a dementia friendly community, you might have a green community, you might have a strategy for housing, you might have a strategy for dementia, for cardiovascular health, but they sure won't talk to each other. So this is about how you can actually bring all of that together and bring all of that evidence, make it very, very easy and accessible for very busy policymakers and also businesses to access and understand. So Richard, if I could just show the video a little bit, just to show you very briefly. This is a toolkit, it's a framework for cities to use, and it's about bringing forward, if you were in a local city, so much of this is kind of, based on local culture. What is right for Sunderland might not be right for Singapore, it might not be right for, excuse the sea, but Cincinnati. So it's very much about how we can action this and bring it all together. So this is very much a framework whereby policymakers can select kind of the drivers in terms of physical activity. They might look at residents, they might look at social inclusion, they might look at where people go to keep fit, such as I know Tina has an interest in dancing. It might be workplace, and it's personalised. And the idea is that you can bring all of that together in a very straightforward framework, AI in the background to really drive the algorithms to help understand what's driving healthy longevity. And this can be personalised to each city, to each community, to each region. But the idea is that it is a starter to try and bring all of that evidence together in an actionable framework that cities can use to really drive healthy longevity, prevention behaviour for their local communities. And then we can share it, because there is fantastic work happening all over the country, in every business, in every country, in every region. But again, it's working separately. And so the idea behind this is that we build a global community for cities of longevity, and we can bring that community together to share what works very rapidly. And then we can refine the algorithms, refine all of that data so that we start to kind of really mobilize this amazing science and data that's pretty well everywhere. So this is very much about making it happen, as Tina said, making all of that policy really, really actionable, so that hopefully in 5 years' time we won't have the same maps which show that there are 16-year difference between the healthier city parts and the lower city parts. That map has been around for far too long. It's now about having action to make sure that we shift the dial and really, really start to make sure that healthier, happier, longer lives are a reality for everyone, no matter where you live, no matter what your background. And it's brilliant to see the UK government have that focus on it, but it really is very much part of an international effort.
Thanks so much, Lynn. Yes, so fantastic perspectives, really interesting and rich sort of tapestry of experiences and perspectives. We know some of the areas that that have been touched upon, but perhaps are worth just mentioning again. The huge injection of investment that the budget has announced in terms of housing, including affordable homes, for example, and of course the capital investment in data and digital infrastructure, which is really, really important in terms of building for that long term. So these are all very good things that have come through from the budget. So I think, I mean, I've got loads of questions, and I'll just kick off the discussion, and then I will turn to the audience here, and then, and Richard, if you can help us triage, and Richard, you may have some of your own questions as well. So, so I'm just going to kick off, and then I'm going to, so literally in the next, so for a couple of minutes, and I can already see some hands raised, but just very, very quickly, just a general kind of, I guess, perspectives on where are you most optimistic and most pessimistic in terms of being able to achieve what the government have said they'd like to achieve in terms of the health mission linked to economic growth. I mean, if we solve the nation's health crisis, the economy is going to grow, right? So just some perspectives from the panel on where they see, where they're most pessimistic and where they're most optimistic. And I don't know if anyone wants to go first.
I'm happy to get both in. I'm most optimistic because of businesses, because I think businesses are grasping this opportunity now and really understanding how their products, their services can really come into people's lives and really kind of bring forward, you know, opportunities for healthier, happier, longer lives. Everything from workforce health, really recognising that, but as David said, also the products and services that are, you know, are really going to kind of change, kind of, for example, sugar in food, etc. Pessimistic in terms of will they do it fast enough? Will it be that sense of urgency? I think remains to be seen. And I think it is very much about kind of, I love what you said about bringing businesses together, because I think so much of this demands an ecosystem of connected businesses to work together. So that's where I'm perhaps most pessimistic about the pace and scale. But I think I'm very optimistic about the imagination, the creativity that is locked in our business leaders and our businesses to be able to bring forward this agenda.
Well, being a scientist, I'm most optimistic about the understanding of aging and all the work and the, you know, the collection of data about the drivers and that difference between the most affluent to the most deprived in terms of how that affects health. And that's where I don't want to say pessimism, but the challenges, I think, and how much crime, unemployment, and other factors in these communities can act as barriers, and that we need to even think wider about the whole holistic approach to those in those communities before people are going to start gauging out, oh yeah, maybe I should go down the gym, or maybe I should be eating XY if they've got what seemingly day in day out higher problems. So I think that's where maybe the strongest challenge is, and got to think about how do you try and tackle a whole raft of things in those areas where the lifespan is so much lower than other areas.
And I agree with all of those. And I think I'm most optimistic because the fact it's now on the agenda and it's now a focus. And I think to the point about organisations, there's almost a preparedness for them to do it irrespective of the government, because it matters so much to them. It's costing us so much money.
Well, fitting the bottom line of businesses now.
It is. And I mean, you know, in the US, they've been looking at things, you know, in a lot more detail than we have for a long time. But I think it is definitely on their agenda and they want to do something about it. The pessimism is, I think it's to your point, David, it's about that behavioural change and whether we can get individuals to engage. Because there's an awful lot of people that don't understand that if they don't do these things, it's not their length of life that's going to be affected, it's their quality of life. And having watched my own parents sort of deteriorate in the last 20 years of their life, it is just so important to keep people living younger for longer. And I think the more we can educate people to actually understand that really it's only them that can take control of that. It's not the doctors, but I think we've got managing expectations is a big issue. And I think there is this expectation people can just be fixed. And I think we've got to change that. And I think that to me is the biggest challenge we've actually got, is at that individual level.
So what am I most optimistic about? I'm most optimistic that I guess a challenge mission approach is being used. So that kind of move away from a siloed intervention, I think, will be helpful. And I hope that, to Charlotte's point, that interdependency across the 5 missions stays as the missions progress and develop their goals and their visions. Because I think once they kind of start to split out and sort of focus on their specific goals, there's a risk that they get siloed again and then just focus on delivering for safer streets or health. But actually, as she mentioned, health is important to growth and equally important to safer streets. So that's what I'm most optimistic about, that the missions approach is being used. I guess I'm most pessimistic of the complexity that they will have to work through. And I think often when people talk about behavior change, we talk about it from a sort of individual's perspective. I actually think that the behavior change needs to be equally within the ecosystems and the organizations and policymakers. And that's difficult to do, right? We've talked about how difficult it is for people to change if the environment they live in actually disincentivizes them to be able to do that and makes it really difficult. We want to make it such that the right choice is the easy choice to make. And therefore that brings in businesses, that brings in that kind of third sector and private sector working together. And we need to be able to figure out how we invest in a way that allows that to happen.
So, yes, and I completely agree with everything you just said. And I think to be able to make these giant leaps forward, i.e. quantum healthy longevity that we've talked about before, to make these quantum leaps, it is about changing behavior at every level of the system. And I think it's individual behavior, but we're all individuals, whether we're a top politician, top business leader. It's about changing the system changing behavior at every single level of the system. And how do you do that? It comes down to incentives. What are the combination of incentives, and which we need to address, because there's all sorts of reasons why we have the status quo is gripped. It's perverse incentives. So that's, I think, the big challenge ahead. But I'm just going to go around the audience to ask for some of their questions.
We have a couple online as well.
And we'll go to the online ones as well. But I'm just going to, so I see Linda, Lynn, David, and I don't know your name, but Niall. So I'm going to go to the back first, just because I know back often, and I'm going to hand the microphone to you. And then I'm going to go to David, and then Linda, and then Niall.
Thanks. I have a question about employers and improving health of their employees. And the country's biggest employer, whose remit is health, is one of the worst in terms of the health of its own employees, both physical and mental and emotional health. So how are we going to actually change the NHS so that it looks after its own people as well as the people it's caring for as patients?
Excellent question. The NHS is one of the world's largest employers, and we have a workforce crisis in the NHS.
Go at that. And I will say, have a go. I think this is actually rooted in the medical model. The NHS has actually been working to that medical model, and we talked about silos. We're treating ill health in silos. You go to a CBT therapist, a counsellor, a physiotherapist, a surgeon, etc., etc. Yet in reality, if we assessed the broader risk factors and use the biopsychosocial model, we'd actually come up with a different set of care pathways that would save the NHS an absolute fortune. But it would also educate the NHS on how to treat their own staff differently. So I think fundamentally we've got a problem with that medical model, and it has to change. That's my thoughts. Who wants to? Cynthia, do you want to go?
Yeah, I'll make an attempt. Similarly. I think, I mean, I would say this, I think this is one of the areas where technology could perhaps help support that. Similar to your point, I think the current model of care is difficult. Technical term. I work for a government organisation, guys, come on. So I don't think it necessarily, so the people who work within the NHS, I mean, if you speak to them, they are optimistic, they're keen, they want to do a good job, they want to be able to support and do the best that they can and work effectively and work efficiently. I think sometimes the infrastructure and the systems that we have in place make it difficult for them to be able to do that. But I think that's positively, I think that's somewhere that technology can help support, such that they spend their time doing the things that add value, as opposed to the things that we do just for the sake of it, as it were.
Anyone else? I say,
Just a really, I think it's a great question then, and I think it's where I think I see technology having a huge role. And as I said at the start, we just haven't had that business model for prevention to date, and so the NHS is like all other kind of organisations where it's been very, very difficult. But if you think about some of the most common kind of, you know, almost pre-cardiovascular issues, say atrial fibrillation, it's something that we're just really not very good at managing, and the opportunity for data to be able to help personalised tailoring of people's behaviour, but also their action when, you know, experiencing something like that is absolutely enormous. And so that's where my optimism that we have got the science and the data to be able to inform it, but we just need to match that to the service and as Tina said, kind of manage that complexity. But you know, there is so much potential from technology to be able to kind of almost help us to answer the right questions. But as a service, we've got to know the right questions to ask of it in the first place.
I don't work for the NHS, so it's difficult for me to judge, but one thing, and maybe is more of a question, is that pushed as a priority in the NHS? Because I know that, you know, waiting lists X, Y, and Z is pushed, but if you don't have prioritised clearly your employees' health and targets and a real focus on it, it will always get pushed down to the bottom. I see it in any work culture where if everybody's busy and everybody thinks it's really important to, like, imagine it's 10 times in the NHS with people's health coming in and out, you think, oh, I'll do that later, or I'll worry about myself another time because I'm too busy doing my job. So you have to have that culture shift a little bit, that my employees' health is as important, and, you know, to come back to that point, but that has to come up top. I don't think will ever change. That has to be recognised, I think, and NHS England have to put that as top, because I think if the workforce is healthy, then the other targets will come as well. So.
Yeah, I mean, it's obviously a very complex issue, and we've got great people in the NHS who are very, very committed to what they do, but the system often conspires against them, which is very debilitating, and the lack of agency and autonomy is, I think, a huge issue for them. And I think that the big injection of funding, the capital investment, obviously they're really relying heavily on the NHS sort of turning things around to become much more productive as an organisation. And I think with the right skills and support, and I guess the money speaks that there is a focus on it, will help, hopefully, the morale of the workforce. But it's obviously hugely complicated and a huge issue. But interestingly, Business for Health, a lot of the work that we've been doing, in the employer camp, we have concluded public sector in that box, because, of course, recognising the NHS. And we've had many conversations, and I think it always comes down to needs must, what are the current priorities? And that's always been the problem. So, yeah, let's hope that this current government are going to, you know, move forward on that front. And there seems to be a will there. So, I'm going to go to David now, because I know you had your hand up first.
Many thanks, Tina. So we've heard quite a lot about what may be working in the UK and what isn't working in the UK. Can we learn more from what is working better in terms of prevention elsewhere in the world? For example, people often point to successes in Singapore and Japan, And we might say, well, if they're different countries from us, we can't really learn from them. But people also point to successes in Switzerland and Sweden and Italy and New Zealand. So perhaps we should be studying them more and seeing what they're doing in terms of behavior change, actually making people active instead of inactive. And very importantly, pushing out the unhealthy products from the shops and allowing the products that you mentioned to have more of a chance. Because it's very hard for these genuinely healthy products to succeed when there are so many addictive things in their place, especially when they are marketed as being, quotes, healthy, but in fact are unhealthy. So in some other countries, the government is much more of a good nanny driving out this unacceptable behaviour. So can't we be taking a leaf out of at least some of what's working well there?
So there's some editorial recently that said, bring back the nanny state. I think it was Matthew Paris, interestingly said that, but yes, over to you.
It's a great question, and it's exactly what we're doing. I mean, and I think we could do it better and do more, but that mentioned the City of Longevity programme, that's about very much working internationally to bring forward those models that work, and to kind of really harness almost like global creativity and imagination to kind of see, you know, where something is particularly interesting. What is particularly interesting when you look at places like Singapore and so on and so forth is that they do have long-term policies, is the first thing I would say, which plays to the earlier point about shorter termism. Places like New Zealand, the Baltics, for example, long had a real focus on well-being, almost like moving from the focus on health to actually really understanding people's kind of emotional, psychological well-being, and actually making sure that well-being is a part of every department, whether it's transport, housing, and so on. So I think we can learn a huge amount. Equally, we can mobilise communities and citizens. And I said at the part, you know, wear several hats, and we poll survey globally almost every day to really understand citizen consumers' perspectives. And actually what's really interesting is when we talk to people about issues that are related to health, what is preoccupying them is housing debt. They can't pay their mortgage. This is the issues that actually then impact how, you know, health later on. It's an obvious point. We've known it for years, but we must do something about it. And again, in countries where they enjoy very high quality of life and very, you know, much longer longevity, often is because they've looked at those wider determinants of health very systematically, long-term policies to address it. And there's something that we can learn quickly. And as I said, it's more about how we assimilate that data and knowledge very quickly and start applying it, rather than constant debate, because we kind of know the issues and it's now about the action to make it happen.
Anyone else? Any other comments? Cynthia? I've got something to say, but
yeah, no, completely agree with that, Lynn. I think all I would add is that, yes, we agree with Lynn. Similarly, we are working with those countries and trying to learn. I think one of the other things they often have is they have a much more, perhaps maybe that's the nanny state, that sort of creative way of using regulation as a carrot and a stick. So it's not just about safety. I think there's a kind of emphasis on value and making sure they really understand what the society values and how to enable regulation to support the activity and the impact and the outcomes that you want to achieve. And we have to recognise that there's also a cultural piece. I think you mentioned something about the fact that 80% of people could probably self-manage their ill health, be it mental health or sort of MSK, but we know that culturally people depend on the NHS. They don't have that sort of necessarily that self-motivational self-regulation, and we can talk about epigenetics and the reasons why things are the way they are. But I think we've got to accept what cultural heritage we have and work within that to enable our communities and our societies to flourish.
I was literally just going to say something very similar in terms of that cultural aspect, because a lot of these countries have had a long-standing culture for this.
Yeah.
I think what we face, America faces, is trying to change that culture, and that is a challenge.
Oh, do you want to say? Yeah, I completely agree. A culture is absolutely, we're very, very rooted in a sick care model. I mean, that's, you know, we see a doctor when we're sick and we need to be fixed, and that's part of the problem. And we're very, very obsessed with our NHS as our prized institution. And we obviously love the NHS but there are certain challenges with actually moving our whole way that we see using the NHS in a more responsible way. Now, one of the things worth mentioning, because Charlotte Bright mentioned this, there's the whole kind of investor piece, and this again comes down to the incentives and the levers for change. I mean, I think, like we've seen in climate, albeit a lot of the criticisms around greenwashing, etc., there, you know, and we've got the COP29 happening this week. There's health is on the agenda, as it was last year. I mean, I think the narrative needs to shift, but, you know, in a process of transitioning away from fossil fuels and moving investment into clean energy, and exactly what the current government are trying to do with its focus on, you know, renewables, etc. We should be doing the same in health. You know, shift investment away from industries that are harming our health and into industries that are creating health. And actually, they're often linked with climate change. It's all linked with climate change, the solutions and root causes. So I think these are also the other big areas that are certainly on the map for exploration. Now I'm going to go to Linda, and then I will come. Don't worry, I've got.
Thanks, Stephen. Well, first of all, this is so exciting to see how much progress you're making, as well as the facts of it. Thank you. You're creating a very important model, certainly for the US. Thanks. I wanted to focus on what was said about how to align the prevention timeline with the electoral cycle. And I'm impressed that we always talk on the prevention side about having wrong pocket problems. Where the money sits is not where the rewards will be reaped. But I'm impressed with how you have made headway on the business case for the corporate sector to indicate that there's a right pocket opportunity there. And I would infer, because some of you are working out of the government itself on this, that you've been able to make progress to align the prevention case with the electoral cycle. And I wonder if you could elaborate on that, if true.
So very, very important question. Would anyone like to start first on that one? Cynthia?
Oh.
Or not yet?
Have we?
You want to?
You're right. We have made some progress. I would like to think that it was because of previous successes where we've been able to demonstrate impact and benefit to the public first, so the economic benefit aspect as well as the societal benefit. And we have worked hard to do that. And I would say that a lot of that is the point I made around being really flexible and using market engagement and market evidence to drive our investments. We worked with Lynn and others to make sure that it was grounded in reality by having that human intelligence inform and shape our investments. I'm trying not to be pessimistic. It is difficult because having catalyzed that and have a growing community of researchers and innovators, we often have a kind of stop-start. So we get everybody going, we get them very excited, we build that community, they're all engaged, and then I run out of funding, just being realistic. And then I have to wait till the next group comes along and try and make the case again and hope to align with their specific interests and sort of political interests as well as commercial ones. So it is, yes, we have made progress, and we are keen to build on that. But there are challenges. Anyone else?
I think you touched on the employer's perspective as well as part of this. And I think what we find with employers is when they can actually see there's an election coming, then they actually put things on hold for 6 to 9 months until it's come out the other side. So it is a problem. And I think it's the same with the NHS. It almost needs to be just like we've taken interest rates away from the government. Why don't we actually take the NHS away from the government and actually put it with a body that can just, not have that stop-start and the issues of funding, but it's something, because it is so critical and so important. And I think we have problems with governments everywhere in the world, no matter whether they're good, bad or indifferent. Sorry.
I think it's a great question, and I don't think that political cycles anymore can be kind of, a fundamental part of this. We have to find a way beyond it, because again, these issues are deep rooted. We've known about the causes of inequality for decades. We have to now look to kind of to communities, to citizens, to businesses, to see what we can do to kind of overcome that and see policy as that framework to enable. I realise that's easier to say than to do, but these political cycles are just too short term. And again, to Colleen's question earlier, when you look to be successful places, the cities, the regions, the countries that are being successful in healthy longevity, they are not beholden to short-term policy drivers. They have got that long-term view. And as Tina said, we see climate change and healthy people, healthy planet, healthy people as the only two games in town. Everything else is how you address it. And the same conversations with climate change, it needs short-term action, but a long-term perspective. Similarly, what is more important than our families, our own health, and it needs that sense of kind of perspective and policy to enable it. So I am optimistic. I'm a natural glass half full, always needs topping up kind of person, but I am optimistic about it. But I think we have got to transcend that policy silos, and that's got to be really the next short-term kind of driver.
So very, very quickly, I mean, I'm quite heartened by some of the discussions that we're having, with the health mission team, advising West Streeting. They are definitely looking to the long term, and already we're seeing some moves afoot with the budget announcement in terms of capital investment. This data and digital infrastructure is key, obviously, for a lot of, to get to where we need to be in terms of understanding and to be able to ask the right questions and come up with the right solutions, and looking at that long-term system change approach. What are the levers that we have to pull? And so a lot of the discussions that we're having, for example, with the Office for National Statistics around gathering the right data to actually form the metrics, et cetera, are really, really interesting. And again, I have to say, I think Rachel Reeves, our Chancellor, she's looking at pension fund reforms, consolidating local pension pots to invest in infrastructure business, British businesses for the long term. I think this is where business investors, pension funds, institutional investors, they do think long term, and so they need the right policy environment. They need the right certainty to be able to put those bets for the long term. So I think there are definitely steps in the right direction, but you're absolutely right, it's not easy. And but we can talk about all the fancy stuff happening in longevity science, shortcutting prevention trials with surrogate endpoints and markers and so forth, which again is another opportunity that we can look at. So you can get the results quicker. You can actually justify investments quicker. So these are all things that are also being discussed, at quite a high level with the Office for Life Sciences and UKRI and all the conversations that we're having. So, I think there's a recognition that we have to move beyond the electoral cycle. And I think if the current government gets it right, they might be in power for 10 years and might have a chance to do it. So we'll see. We shall see. Anyway, I want to go to you, and then there's a question at the back, and I know you want to have a question as well. So
thanks,
you also did, didn't you?
Hi, my name is Hannah McCarthy. I'm Chief Behavioural Scientist at a company called Better Points in the UK. And I'm also a PhD candidate at UCL, and my PhD thesis is on the optimisation of incentives in apps for physical activity behaviour change. So everything that's been said today is absolute music to my ears. Thank you so much for all of your comments. I think hearing sensible things being said about wearables, about short-term incentives being needed to combat long-term health behaviour change, visions not resonating with people are all really important points. But the question I've got is, how do we avoid reinventing the wheel when it comes to engaging with business and innovation? I've been doing this now for nearly 10 years, and I hear all this talked about as if it's new stuff. And I've put in umpteen applications for Innovate UK funding.
Oh dear.
Spoken to the DFT and to the DHSC, and we seem to get nowhere. So I just want to say, how do we engage small businesses? How do we ensure that we're not throwing public money down in places to reinvent wheels?
So I'm going to only have one answer because I know we've got quite a few questions coming through, and I also want online team to have a question. We've only got 10 minutes left. So I was going to look to David or to Cynthia. Who would like to answer the question?
Happy for you to just.
I feel England's biting a bit I mean, I agree. You know, 24 years we're doing aging research, and I see a lot of companies talking about biological age. My challenge always to them is, but we know what drives biological age lower. You know, and I've said it before. But how do you implement that? How do you get it changed? And maybe a slight frustration is what the learnings are of trying to do it, and then move to say, okay, we've learned how not to do it in that situation. And to the point about politics, etc., I can't help thinking, if you can shift health in a city or an area and show you can make it work, and then the economical benefits that come, it will be a springboard. But you have to, I think you have to get that data, and that will help persuade and show the wider argument. And maybe
I've got a sneaky little comment, because I totally agree. I mean, that's why we established the Quantum Healthy Longevity Programmes, to stop reinventing the wheel, stop duplicating effort, and bring it all together. And that's what we've been working on. And I get your point about cities. This is why City of Longevity is so important, because it is in places, it's in communities. I'm from one of the most deprived areas of the UK. I'm from just outside Middlesbrough, in the northeast of England. We have kind of atrocious healthy life expectancy for my own family, indeed. But City of Longevity, where you can see the real step changes, not from grand policies and from major changes. It's the fact that the local bank decided to keep its high street store open. The local bakery decided to put less salt in its bread. The local pub decided it would serve non-alcoholic, non-sugary drinks to local walking groups. And the local walking group encouraged people who were from the most deprived areas of the community to come along. It's the fact that the local theatre company opened up an afternoon matinee, and the local transport authority made sure that there were buses to take people home. This is a city, a community working together, tiny, small behavioural nudges to encourage positive choices and to address issues like loneliness and the lack of connectedness at its very heart. Because when you're in the northeast of England, the most deprived area, it's not the big policy issues that preoccupy you, it's having a job. And it's also being lonely and isolated that actually bring young people as well as older people down and cause so many healthy problems. Cities of longevity, cities, places is where we can really affect the change. And this amazing policy can be framework, and the data, the intelligence and the glorious businesses that we have can then work within that framework. And I think that's what this is about in terms of that really nudging healthy behaviour. And that's why I'm optimistic about what we can do.
Very quickly, Dan Buettner, you know, the guy who's invented or did all that work with Blue Zone, some of you may have heard of, he will say that it's, you know, living a healthy, long life is a byproduct of having a supportive environment. So all those Blue Zones, they do all the stuff that you've just been talking about. So I'm going to go to Debbie, because I know you've been very patient, and then I will come to Les next.
Debbie Marshall, Silver Marketing Association. I'm just going to pick up on what Lynn said. It's led quite well to my question. I'm fascinated by the cities of longevity. You've just given an example of your own community local to you. But are there case studies that you can actually name around the world who are actively today embracing the city of longevity? Can we see those case studies? Where are they? And importantly, how are they marketing themselves as cities? Because if they are applying this policy and it's working, then not only should they be broadcasting that as great places for older people to live, but also on the tourism side, great places to visit.
And I would say great places for everyone to live.
Yeah, very, very quickly, so I'm sure there's a lot more, but it's a great question. And yes, they are. They're coming together. These cities are Berlin, we've got Bergamo, we've got Buenos Aires, Hamilton in Canada, Taipei in Taiwan, Newcastle, obviously, where we're based, and they are coming together and they are marketing it, but they're also learning from other cities, Singapore, the Baltic states that people mentioned earlier. This is about growing a global community of kind of, really kind of longevity ready cities and communities. Businesses are a fundamental part of that. And as Tina said, really nudging those environments to be healthier and happier. We have a partnership with Edelman, one of the world's largest PR comms agencies, to really help to take that step change, to change the narrative on healthy longevity, because we know that communication piece, making sure that people know about what's good and can really adopt it is so important. So it's work in progress. But again, encourage anyone who's either on the call today or here, to contact us and let's see if we can kind of grow that network a little bit more, and then really start to spread the word about what's working.
So I know that we've only got 5 minutes, and Richard, you're going to ask a question.
Summarize the online. So thank you for those of you online for being patient. But there's been a lot of discussion online, from here, about social prescribing and the importance of engaging at that level. And we can use that question as a summary, I think, which would be very good. And another question, which is actually from me, being here, I can ask it, and it's relevant because we have Dave Gunn here. It's about academic industry partnerships. How important it is. We're in a university setting, but we have Unilever embedded within King's, and I don't think they've mentioned it, but I think that's a very good case study, how we can actively engage with industry to develop both the social impact and also the biological research together, and also to engage with each other's ecosystems. So I'll hand that over to you.
Anyone want to pick up on the point of social prescribing, or indeed refer on?
Well, maybe actually. Sorry, Lynn, it's a question for you. So on the private partnerships going on, is that something in these longevity cities that is happening much, or is it all driven through kind of the research? I mean, you mentioned, one thing, I work for obviously a very large company, but it sounds like in a lot of communities, the small companies, the bakery, the pub, etc., little initiatives from them can make a big difference.
Yeah, I think we need everyone. Some of the biggest companies like Unilever, they're in billions of homes every day, and so they matter hugely. Equally, the tiny startups have got the most creative, imaginative ideas. What a step change, what a quantum leap they will help us to make. And then the existing businesses. Our world is made up of small community businesses. Most of us work in small, medium enterprises. They are the heart of our communities. And again, they don't necessarily know what an amazing opportunity they have to make a return on investment, a return on their business, but also a return on society. And they kind of, again, we can take it to them and nudge their behaviours, their actions, but it can benefit everybody in terms of, healthier places and healthier lives. And so every business matters. The big ones, Unilever, hugely important. But as Richard said, that science generated generating the best possible science that we can. The UK is amazing at that. We have fantastic science, fantastic businesses, but equally we need to work, much more as we are doing, collaborating with other places, the US, Singapore, everywhere, so that we can bring that together, have complementary science, but bring it, to be impactful into everyday lives. That's basically the agenda here.
So I'm going to, just because we've only got a couple of minutes left, Pamela, do you want to speak to the point about social prescribing? Because I know...
Probably not.
Okay.
There's a few more questions as well, so yeah.
Okay, because I know social prescribing is massively on the agenda. In fact, we work with the National Association of social prescribing, actually, and I know I've got some colleagues here who are very involved in that agenda. But it's a massive focus that is still very much a work in progress, and it's crucial. I mean, I think there's a lot of social prescriptions that can be hugely beneficial that can be prescribed by GPs, and again, it speeds to the whole ecosystem of a lot of the people here who are all probably very, very involved in social prescribing, and I think is a huge factor that needs to be looked at as part of the recipe moving forward. But I think we've got 1 minute left. I will now, Niall, sorry, yes, I had Niall, but you were first in the queue, so you get last chance, last question.
I appreciate it. Great talk today. I'm fairly new to this scene. I come from the private sector, to a deep tech AI company addressing life quality. This question to Dr. David. What does Unilever do internally? How do you engage, because you're a fairly massive company, number of employees, how do you engage your employees? What's worked, what hasn't worked?
I can speak because in terms of our site, so there's a small group of 8 at basic guys within the university environment and actually hospital environment as well. It comes to the point before about the NHS and how you look after your employees. For me, you've got to push narrative that their health, employees' health, is as important as anything else they're doing at work, and that has to come through leadership and constant reminders, and I have to constantly remind myself. So I think that narrative of if you look after your employees, the employees look after your business, that has to be a strong element of any successful business, I would say. And I'm sure, I can't speak for anybody in the NHS, but I don't know how much that's pushed. And I'm really speaking more from sort of my experience as employee, and some of the good leaders who I felt have led well, etc. They have always had a strong health and safety, and as part of that, the healthy employees has been an element of that not just work-based accidents, but how people are doing and supportive environment. So just speaking from a very sort of smallish group, my personal experience as employee, I would say that has to be front and centre as a narrative within a workplace.
Interestingly, Edelman, they produce the Trust Barometer report every year, and actually employers rank tops in terms of people trusting to look after, to help people with their health. So I think that's quite interesting. So, and I think it's about leadership and, and also line management and other factors. So I think we're going to have to leave it for today because time is up. And but just wanted to say thank you so much to all of you for coming and being part of the discussion.
And those online.
And those online, exactly. And thank you so much to our panelists. And yeah, let's let's keep healthy and happy and living longer. And thank you, Victor.
Just to end, thank you, Tina, Lynn, Dave, Pamela, and Cynthia for coming, and of course the audience, those of you joined online. Apologies that you could not hear the video if you were online. Please do email us and we'll
share the recording.
Yeah,
we'll share the
recording as well. And just to end, we do have another ARC Longevity Week event on Thursday. You've probably seen it on social media. If you're available, come along. It's going to be in the building right across the street, or join us online. So thank you again.
Thanks, Richard. I didn't want to put you on the spot.
No, it's just, I mean, social prescribing that I'm aware of, hasn't really worked much in practice.